Imagine a patient who struggles to understand medical information due to additional communication needs, or a person in pain trying to navigate an inaccessible clinic. Today, we're talking about how reasonable adjustments can break down these barriers and ensure that people living with disabilities and long-term conditions get full access to the care they need. Reasonable adjustments for people living with disabilities and long-term conditions. According to the Equality Act, a person has a disability if they have a physical or mental impairment and the impairment has a substantial and long-term adverse effect on their ability to carry out normal day-to-day activities. Examples can include physical disabilities, mental health conditions, cognitive conditions such as dementia, being deaf or blind, learning disabilities, and autism. Now, let's look at some ideas of simple adjustments that could have a huge impact on experience and make healthcare more accessible for everyone. Communication. Use clear, simple language. Ask one question at a time. And listen. What could facilitate access to care? For instance, easy-read documents can make complex medical information clearer for people with learning disabilities. Or you could book an interpreter when needed, such as a British Sign Language interpreter. Physical accessibility. Ensure the equipment you're going to use is appropriate, that pathways are clear, and use visible, colour-coded signage. For example, you could use adjustable examination tables when needed. Appointment management. Try offering longer appointments where it would be helpful. More time also means more opportunities for you to understand the reasonable adjustments that could help your patient. Clustering appointments and using reminder services can help reduce visits and avoid missed appointments. Cultural consideration. Evidence shows that cultural needs often overlap with reasonable adjustments. Considering dietary requirements or avoiding scheduling appointments that conflict with a person's religious practice, such as prayer times, can facilitate their access to essential healthcare services. These examples show just how simple adjustments can have a big impact on a person's experience. But remember, everyone is different. Two people with the same condition may still need very different support. It is crucial to provide personalised care and adapt these reasonable adjustments to each individual. Key actions to remember. Ask, don't assume. Reassess an individual's needs regularly. They might change. Document their preferences in health records and relevant online systems. For example, use the Reasonable Adjustments digital flag. This allows staff to record and share key information so adjustments are known wherever someone gets care. Be proactive. Offer and inquire about reasonable adjustments earlier rather than later. Maintain dignity. Respect privacy, involve patients in decisions, and support independent choices. We may not always get everything right every single time. However, clear, open, and sincere communication will ensure that our patients feel cared for and experience fairness in our healthcare services. Thank you for taking the time to learn how to create a more inclusive healthcare experience.